This week we're looking at what to expect from rehab following a hip replacement surgery, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So, the total hip arthroplasty surgery or hip replacement. Now, this is a little bit different than after the knee replacement. We'll see people have this surgery not only from severe arthritis and pains that don't respond to therapy. This surgery is the first thing to treat a vascular necrosis of the hip. Now, most of the body has a redundancy of blood flow, just meaning different blood vessels travel to the same area to ensure that if blood flow is restricted, other vessels can still deliver everything that the body region needs. With the CFJ or the hip joint, that's not quite the case. It gets blood flow from pretty much one vessel, so if that blood flow is impeded, the ball part of our ball and socket joint dies. Avascular, no blood flow, necrosis, dying tissue. Now, I don't want to scare people. This isn't guaranteed to happen. It's just one of the things that can lead to this hip replacement. Now, there are a few different approaches to get to that hip joint when having this surgery, which definitely makes aftercare different depending on what approach they do. There are movement precautions depending on how each surgeon went in and accessed that hip joint as well. The anterior approach, going in through the front of the hip, you won't be allowed to extend the leg back behind you, so no lying on your stomach and definitely short strides. We're also not allowed to rotate the foot outwards. Also, actively kicking the leg out to the side into abduction is a big no-no. Now, the lateral and the posterior approaches, going in through the side or the back, you won't be able to cross the legs in any position. No moving that leg past midline. We also can't bend the hip past 90 degrees, so no bending forward, no sitting in a chair lower than our knees. We also do not want the foot rotating inwards. Some surgeons after this also do not want that outward hip abduction either. Also, depending on the surgeons, will be how long these precautions last. Usually it's between 6 to 8 weeks. During this time, we're still going through rehab, which starts within a few hours after surgery. PT will be in your room to get you up and moving. We'll also see how far we can walk, and we're going to see how long we can sit up in the chair as well. Us, the nurses and the doctor, will constantly drill you on your precautions as well. Depending on how well you're doing, you're either going to be going home or to a rehab hospital. Now, the rehab hospital will have several hours of rehab a day for a week or so, and then they'll send you home. Now, once you're home, you'll either have some in-home PT or you'll start going to an outpatient therapy location. We're working on range of motion, strengthening, walking drills within those precautions. We progress as quickly as the body allows us to. Now, once those precautions are lifted up, we start working on motion and flexibility more. We don't just jump into it. We start off fairly conservatively and slowly get more and more aggressive with that stretching. Usually our goal is to get people finished with therapy by around month number 4. Sometimes it takes a little more time, sometimes a little less. Just make sure to listen to the surgeon and the PT and work hard. You're in control of your recovery. Again, I'm Dr. Mike Matthews, physical therapist here with the PT411. Thanks for joining me.